G'day, folks. I'm Dr. Zoe Mitchell, and I've been working in men's health for over 20 years now. And look, I'm going to cut straight to the chase today, because what I'm about to share with you could genuinely change your life. According to research from Harvard University, blokes who ejaculate more than 21 times a month have a significantly lower risk of developing prostate cancer compared to those who do it less than 7 times. Now, I know what you're thinking. That sounds almost too good to be true, right? But stick with me here, because there's a lot more to this story, and some of it might actually surprise you. You see, after 2 decades of treating men across Australia, from Perth to Brisbane, I've had countless conversations about prostate health. And let me tell you, most fellas don't want to talk about it until something goes wrong. But here's the thing. Your prostate is this little walnut-sized gland that plays a massive role in your reproductive system. It produces prostatic fluid, which is a key component of semen, and it sits right there in front of your rectum and below your bladder. Despite how important it is, most men don't give it a second thought until they start having drama with it, like pain, difficulty urinating, or worse, cancer. Now, to give you some perspective on why this matters so much, prostate cancer is the second most common cancer among men worldwide, right after skin cancer. And mate, the statistics are genuinely sobering. We're losing good blokes to this disease far too often, and the frustrating part is that with more awareness and less stigma around the topic, many of these cases could have been caught earlier or even prevented altogether. That's why I reckon we need to have this yarn today, even if it feels a bit awkward at first. So let's talk about masturbation. Now, I know this isn't exactly dinner table conversation, but as your doctor, I've got to be straight with you. For years, this behavior was stigmatized and surrounded by completely false beliefs, like it being harmful or somehow immoral. But the science tells us a different story altogether. Research has actually shown a direct connection between masturbation and prostate health, and understanding this connection could be one of the best things you do for yourself, especially as you get older. Here's what happens in your body when you ejaculate regularly. Studies have shown that regular ejaculation can actually help clean out your prostate by reducing the buildup of chemicals that, when present in excess, can lead to inflammation, or even encourage the development of abnormal cells. Think of it like giving your prostate a bit of a flush out, if you will. So for many men, maintaining a healthy frequency of ejaculation can actually help reduce the risk of conditions like prostate cancer. That's not just my opinion, that's what the research is telling us. But it goes beyond just the physical stuff, and this is where it gets really interesting. Masturbation also affects emotional and psychological factors. Heaps of men tell me that it helps them reduce stress and release the tension that builds up from everyday life. And look, this isn't just anecdotal. According to studies, the body releases a cocktail of chemicals during ejaculation, particularly dopamine and endorphins, which promote feelings of relaxation and pleasure. Your mood improves, anxiety decreases, and these chemical effects have a genuine impact on your overall well-being. Now, I want to share something with you that I've seen time and time again in my practice. The connection between stress and prostate problems is something that doesn't get talked about nearly enough. I had a patient come in, let's call him Barry from Ballarat, and he'd tried everything for his prostate issues. He'd seen urologists, tried all the natural remedies, the lot. Nothing worked. But when we started talking about his life, it turned out he was dealing with massive stress from family drama. His boundaries weren't being respected. He was being run-ragged by everyone around him. Once he addressed that, once he started setting proper boundaries and looking after his mental health, his prostate symptoms actually improved. Fair dinkum. The mind-body connection is powerful stuff. So while we're talking about the benefits, I also need to be honest with you about the other side of the coin. Masturbation, like anything else in life, needs to be approached with balance. Compulsive behavior can disrupt other aspects of your life, including your relationships, your productivity, and even your mental health. A cycle of emotional or even physical dependency can develop when some people use masturbation as a coping mechanism for uncomfortable feelings. At that point, it's important to recognize when a habit is no longer serving you and has become a problem instead. And here's something else I need to mention because I see it all the time in my clinic: the issue of excessive pornography use. This is a sensitive topic, but it's often closely connected to masturbation habits. Now look, pornography can be stimulating, but excessive consumption has been linked to problems like desensitization to intimate pleasure and unrealistic expectations about intimacy. I've had patients, good blokes in their 60s and 70s, who've developed issues with erectile function not because of any physical problem, but because they've rewired their brains through too much porn. They can't perform with a real partner anymore because their brain has become accustomed to the artificial stimulation. For those of you who want a more balanced relationship with masturbation and consequently with your personal health, limiting pornography is a wise choice. Let's get back to the science for a moment, because there's more fascinating stuff I want to share with you. That Harvard study I mentioned earlier found that men who ejaculate more than 21 times per month have a notably lower chance of developing prostate cancer compared to those who ejaculate fewer than 7 times. Now, despite its seemingly arbitrary nature, this figure actually has a solid rationale behind it. By eliminating potentially harmful compounds that can accumulate over time, ejaculations contribute to detoxifying the prostate. This finding confirms that choosing the right frequency matters, both for health prevention and for enjoyment. And here's something that might surprise you even more. This effect isn't limited to masturbation alone. Intimate activities with a partner, and even erotic dreams that trigger spontaneous ejaculation, can play a similar role. This indicates that the regularity of ejaculation is more important for prostate health than the specific cause of ejaculation. It reminds us that our bodies are highly adaptable and constantly seeking balance. The effect that masturbation can have on the immune system is another fascinating truth that few people are aware of. According to research, there's a temporary increase in white blood cells, which are essential for fighting infections and strengthening the immune system during masturbation. In other words, masturbation could help strengthen the body's defenses and reduce stress, especially during times when the body is more vulnerable, like during high-stress periods or seasonal changes. Here in Australia, with our brutal flu seasons, that's worth knowing about. And that's not all. Studies have also shown that masturbation contributes to lowering blood pressure, particularly in people with moderate hypertension. This phenomenon is due to the release of oxytocin and other hormones during orgasm, which relax blood vessels, improve circulation, and simultaneously lower blood pressure. This is evidence that the effects of this practice extend far beyond the realm of intimacy, even though it can't replace proper medical care. Now, let me take a moment to address something that might seem paradoxical. When we consider the human body as a whole, it takes on its full meaning. Frequent ejaculations could, in certain situations, deplete the body's energy and lead to fatigue or even cause a weakening of the reproductive system, as described in certain cultures and traditional medical systems like Ayurveda. While modern science doesn't generally agree with this view, it reminds us that moderation is essential. Even seemingly healthy behaviors can become harmful when practiced excessively or improperly. The connection between masturbation and emotional health is often overlooked. Although we just discussed stress reduction, it's important to remember that masturbation can also play a different role. For some people, it's a beneficial approach to connecting with their body and exploring their intimacy. However, it can become an obstacle to self-awareness and mental health when used as a coping strategy to avoid dealing with difficult feelings. Understanding how and why you engage in this behavior is crucial. So, how do you put all this into action to ensure that this habit actually improves your health and well-being? This is the main question. And I'm going to give you some practical answers that have worked for my patients over the years. One of the most important things to recognize is the direct connection between a balanced lifestyle and prostate health, as well as overall well-being. Frequent ejaculations are helpful, but they're only part of the picture. According to some studies, physical exercise has a significant impact on prostate health. Regular walks, even just a 30-minute stroll around the block each arvo, can reduce the risk of inflammation and improve blood circulation in the pelvic region. Therefore, combining exercise with intimate activity or masturbation is an effective tactic. Diet is another crucial factor, and this is something I really want you blokes to pay attention to. A diet rich in antioxidants, such as red fruits, green tea, and tomatoes, which contain lots of lycopene, can help protect the prostate from damage caused by free radicals. Zinc is necessary for normal prostate function, so zinc-rich foods like nuts and seeds are valuable allies. And while I'm on the topic of natural remedies, I've had good feedback from patients who've tried saw palmetto and pumpkin seeds. Some fellas swear by pycnogenol too, about 160 milligrams daily. Combined with moderate masturbation, these eating habits form a solid foundation for good health. Let's talk about sleep for a moment, because this is something that often gets overlooked. Research suggests that prolonged sleep loss can increase the risk of prostate dysfunction and dysregulate levels of intimacy, hormones, including testosterone. That's why rest is just as important as any other health habit. Remember that masturbation shouldn't replace sleep or other necessary activities. In this situation too, balance is crucial. The influence of emotional state is often underestimated. People who experience a lot of stress or worry may turn to masturbation as a coping mechanism. Although this can temporarily reduce stress, it's important to treat the root cause. The temptation to use masturbation as a means of emotional release can be alleviated by stress reduction techniques like yoga, meditation, and mindfulness. For those of you who believe the practice has turned into compulsive behavior, this is particularly important. Now, I want to address something that one of my patients brought up recently, and I think it's worth sharing with all of you. He asked me straight out, "What's the right frequency? What should I be aiming for?" And look, the honest answer is that it varies from person to person. But based on the research, somewhere between 2 to 3 times per week seems to be a good baseline for most older blokes. That gets you to roughly 12 to 15 times a month, which is in that beneficial range without overdoing it. But listen to your body. If you're feeling fatigued or it's becoming compulsive, pull back a bit. If you're going weeks without any release, that might not be ideal for your prostate either. I also want to talk about what happens when you don't ejaculate for extended periods. Longer time frames without masturbation or intimate activities can lead to an accumulation of secretions in the prostate, which increases the risk of infections and inflammation. It's important to recognize and respect your body's limits. This doesn't mean you need to force yourself into some rigid schedule, but being aware of this can help you make better decisions about your health. Here's something else I've learned from my 20-plus years in practice. The men who do best with their prostate health are the ones who take a holistic approach. They're not just thinking about ejaculation frequency in isolation. They're eating well, they're staying active, they're managing their stress, they're getting enough sleep, and they're maintaining good relationships with the people around them. Your prostate doesn't exist in a vacuum. It's connected to everything else going on in your body and your life. For those of you dealing with existing prostate issues, whether that's benign prostatic hyperplasia, prostatitis, or you're monitoring something more serious, please don't take this video as medical advice to replace what your doctor has told you. This information is meant to complement your existing care, not replace it. Always have these conversations with your healthcare provider, and don't be embarrassed about it. We've heard it all before, trust me. I want to circle back to something I mentioned earlier about the psychological component, because I really think this is underappreciated. In my experience, men who are dealing with chronic stress, who feel powerless in their relationships or their work lives, who aren't setting proper boundaries, these blokes often have worse prostate health outcomes. The stress hormones coursing through your system have real physical effects on every part of your body, including your prostate. So if you're dealing with toxic relationships, if you've got family members who are taking advantage of you, if you're burning yourself out trying to please everyone else, addressing those issues might be just as important as any supplement or medical treatment. Let me also say this. I know a lot of men my age and older grew up in a time when we didn't talk about these things. There was shame around masturbation, around prostate health, around anything to do with that part of our bodies. But times have changed, and there's no place for that shame anymore. Taking care of your prostate is no different from taking care of your heart or your lungs. It's just basic health maintenance, and there's nothing to be embarrassed about. For those of you who are married or in long-term relationships, I want to acknowledge that intimacy can be complicated as we get older. Performance issues, changes in libido, health conditions, these can all affect your intimate life. But maintaining some form of regular ejaculation, whether through intimacy with your partner or through masturbation, remains important for your prostate health, regardless of your relationship situation. Have open conversations with your partner about this. You might be surprised how understanding they can be when you explain the health benefits. Now, as we wrap up here, I want to leave you with some practical takeaways that you can implement starting today. First, aim for regular ejaculation, somewhere in the range of 2 to 3 times per week as a general guideline. Second, incorporate prostate-friendly foods into your diet, things like tomatoes, green tea, berries, nuts, and seeds. Third, stay physically active with regular walks or whatever exercise works for you. Fourth, manage your stress through whatever means work best, whether that's meditation, hobbies, spending time in nature, or setting better boundaries with difficult people in your life. Fifth, get enough sleep, because your body does important repair work while you rest. And sixth, don't be afraid to talk to your doctor about any concerns you have. Remember, mates, everyone is different. What works for one bloke might not work for another. And it's important to consider how these habits affect your own life. The key takeaway here is that masturbation is a normal behavior, and being aware of it helps you understand when and how it can be harmful and when it can be beneficial. This is an essential step in maintaining overall health and prostate health. Your prostate has been quietly doing its job your whole life. Maybe it's time to return the favor by giving it the attention and care it deserves. If you found this information helpful, share it with a mate who might benefit. Sometimes the blokes who need this information most are the ones who are too embarrassed to search for it themselves. Look after yourselves, and I'll catch you in the next one. Cheers.